Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, government goes all out to contain the rapid rise of COVID-19 cases in the country. Officials consider a massive forced quarantine for suspected patients. 2 more weeks into the enhanced community quarantine, will the situation get better or worse? Former Health Secretary Esperanza Cabral will give her assessment. The Philippine General Hospital is now at the forefront of the COVID-19 fight. PGH spokesperson Jonas del Rosario shares the challenges. And later, time flies so quickly. It's just April 1st, and yet so much has been happening here and around the world. Netizens share what they have learned in the last 3 months of 2020. The surge of suspected coronavirus cases seem inevitable. To prepare for this, the government is looking for structures that can be transformed into forced quarantine areas. COVID-19 Task Force Chief Carlito Galvez identified 6 facilities in Manila, Pasig, and Bulacan. These are the Rizal Memorial Coliseum, the World Trade Center, Cultural Center of the Philippines Complex, Philippine International Convention Center, Philippine Arena, and the Philippine Sports Center. At the moment, there are 2,084 people diagnosed with the coronavirus in the country. Let's go straight to the source of the story. We have former Health Secretary Esperanza Cabral. Dr. Cabral, welcome to the show. Thank you for your time.
Good morning, Pinky.
Good morning to you. You know, Doctora, yesterday we recorded 500 plus new cases of positive COVID-19 patients. Can we expect the number to peak this week? Are you expecting a downward trend, or can we expect the worst still in the coming weeks?
I think the worst is still to come. I don't think we are peaking next week or even the week after, because I don't think we have controlled coronavirus yet. And I think that we are discovering the cases because we are doing more tests. So we expect the number of positive patients to increase in the coming 2 weeks or so.
How do you assess the first 2 weeks of the enhanced community quarantine? Now we're entering, or we've actually entered the 3rd week.
Well, I always say I'm sure they're trying to do their best, but they have to do their best pa more, because we are obviously not making the kind of dent that we want to do.
Dr. Cabral, when is, you think, the date of reckoning here? When will we find out if what government is doing, such as the enhanced community quarantine, if it's actually working or not?
We will have to do more tests, and if we have done 10 or 20,000 of them, we can more or less determine what is the prevalence of coronavirus in our community. And we can say perhaps that at the time we have controlled or not controlled coronavirus.
But when you talk about such tests, Dr. Cabral, you're talking about individual tests or tests in total?
Yes. The number of unique individuals who have been tested. I'm not talking about the number of tests per se, because majority of those are repeat tests on an individual who has had coronavirus.
Okay, there is a call to action. It's a position paper that you wrote together with your son, Dr. Brian Cabral. I want to run
Yeah.
through this first. It's four imperatives that you identified. The first is know your enemy, which actually talks about mass testing. But the problem is, how can this be done, Dr. Cabral, when government is challenged saying there's a problem because we don't have a lot of test kits?
Well, we do have a problem. We do not have enough test kits, but they must get it. If they want to go to the problem directly, they must know how many people have had the virus. If not, we won't be able to make any correct plans and we won't be able to act accordingly. They say that it is not a problem of
The second
money, that
imperative
they
is
have a lot of money, but it is a problem of getting the tests here. So they must do that. Get the tests here.
are you in favor of these rapid test kits that the FDA had recently approved, five of them, four coming from China and one from Singapore, Dr. Cabral?
Well, there are many conditions to that. Number one is the rapid test is a test for the antibodies against coronavirus. It is not a test to diagnose who has coronavirus at this point. But the rapid test for antibodies has a place. What we can do with it is we can test the community to find out who are already immune to coronavirus. And these are the first people we can let out of the lockdown so that they can engage in economic activity. There is no reason why these people should be quarantined. They are already immune to the coronavirus. They should be able to go out and perform economic activities, do gainful employment so that they do not get hungry and their families do not get hungry.
I understand, Dr. Cabral, this is a new proposal of yours. This is not forming part of your four imperatives, but I want to dig deeper into this. So basically, can you give us a sample on what and how this can happen? Are you looking at a particular local government unit to start these rapid test kits, and then what? Do we separate the obviously the positives or the PUMs and PUIs to those who are going to be tested and end up negative? How does this work?
Okay, Pinky, yesterday I got together with Dr. Edsel Salvania and Dr. Jean Solante, who are both infectious disease experts, as well as Dr. Junice Melgar, who is a community organizer and has worked all her life to look after the health of the poor. We agreed that first we need to validate the rapid testing kits. And if we find out that they are good, we can pilot it in a community. In this case, we are looking at Quezon City because Junice is in conversation
Mhm.
with Mayor Joy Belmonte about helping in the coronavirus issue. And what we can do is use the test
Mhm.
to determine who in the community would be immune or are already immune to coronavirus. And we can suggest that these are the people who can be removed, released from the lockdown in order to perform economic activity. If this happens everywhere, and we see that there are
I'd like to
very many people who are already immune to the virus, then we can prevent a lot of social unrest because as of now, hundreds of thousands of families, millions of people are going hungry. I don't think they can tolerate this kind of situation for a very long period. And what we are looking at is really social unrest. We must prevent this at all costs. And this is a way that we can possibly do this.
I have a question on that. I need to clarify this. You're saying that if you use these rapid test kits, that it should be validated first and foremost. You can use it, for example, in a sample population in Quezon City, and if they are negative, they can be set out and basically separated, and they can go about doing their usual everyday life. However, when I was speaking to Director General Eric Domingo yesterday of the FDA, the spokesperson also of the DOH, ma'am, he was saying that there's a possibility that these rapid test kits could also give you a false negative result. Wouldn't
Oh,
that be dangerous as
all
well?
tests can do that. There is no test that will be 100% perfect. That will give you 100% sensitivity, 100% specificity. And there is a certain level of this predictive value that we can accept. And that's the reason why we need to validate which is the test that is most acceptable for this purpose.
All right.
It's like
Just
drugs and
also, I want to
medicine.
run through this. That's called the. I see. Okay. There are four imperatives we talked about. Know your enemy, and the second you were saying is that taking care of the ill, addressing the capacity of hospitals who are unable to admit COVID-19 patients. Very quickly, Dr. Cabral, what do you think of government's plan to designate forced quarantine areas such as the CCP, the World Trade Center, the Rizal Coliseum, and other areas, ma'am?
Well, that is part of the recommendation that we made in our call to action, that people should be quarantined, taken out of their homes until they are better and assured that they are not infective. Because at the moment, the quarantine is ineffective because most people do not have enough space in their homes to be really isolated from
Yeah.
the rest of their family and community.
The third and the fourth imperative you're talking about is obviously protecting the frontliners. The DOH is saying they already purchased or procured 1 million sets of PPEs, totaling about 1.8 billion pesos. And four is also protecting the citizenry. It's a proactive approach, Dr. Cabral, because you want to be able for government to start looking for ways to be able to get back, for us, for the public to get back on our feet. Doctora Esperanza Cabral, former DOH Secretary, thank you so much for your time.
Thank you very much, Pinky. Stay
And
safe.
coming up, as the Philippine General Hospital... I will, you too. And coming up, as the Philippine General Hospital begins to treat COVID-19 patients, we'll find out how the team there is keeping up with the extreme challenges. This is The Source on CNN Philippines. You're watching The Source on CNN Philippines. Frontline health workers are at high risk of catching the coronavirus. 17 doctors have died in the COVID-19 battle in the country. The Philippine Medical Association, or PMA, released the latest figures. Their president thanked those who lost their lives. The group says deaths could have been prevented if there was enough protective gear. PMA's Commission on Legislation Chairman Dr. Oscar Tino says, in fact, more doctors want to help, but they're hesitant because of this problem. At the beginning of the week, the Philippine General Hospital launched its Operations Center for COVID-19. On Facebook, the PGH Medical Foundation announced that aside from the center, they have a hotline for patients, information for donors, as well as volunteers. 2 wards of the hospital have also been retrofitted to care for COVID-19 patients. Construction firm DMCI used prefabricated materials like walls, exhaust frames, and stairs. That's to seal the facility from the rest of the hospital. The wards are also equipped with ventilators and negative pressure rooms to prevent contaminated air from going out. The construction was completed in just 5 days. Let's go straight to the source of the story, Philippine General Hospital spokesperson, Dr. Jonas del Rosario. Dr. del Rosario, welcome to the show and thank you for your time.
Good morning, Pinky.
PGH now a designated COVID-19 referral hospital. Dr. Jonas, can you tell us the situation there now?
All right. We started on March 30, officially making PGH a COVID-19 referral hospital, which means we will be catering to patients who are COVID-19 positive. This will be done through a referral system. Patients will be coordinated by referring hospitals. This has to be cleared by the Department of Health RESU, Regional Epidemiological and Surveillance Unit. So they will be conducted to the Philippine General Hospital and we will accept them accordingly based on our vacancy.
How many patients do you have at the moment?
At the moment, we have 28 COVID-19 positive and 26 PUI or persons under investigation. We have 130 beds allocated for COVID-19.
That means, Dr. Jonas, you can still take in maybe about 70 to 80 more patients.
That's right at the moment as we speak, yes.
What are the needs, Dr. Jonas, of the frontliners now?
Before we opened the referral center or the COVID-19, we made sure that we have enough supplies for our frontliners, especially the personal protective equipment. We also gave them enough training on how to handle these patients. We have, just like what you mentioned, we are equipped now because we got ventilators, partly from our own funds and partly also from the donations of some hospitals and private donors. The need really is evolving. As of now, we have enough to last for the end of the month or April. So far we're okay.
That's good news, sir. You're saying you're good for the whole of April.
That's right. We calculated that about 500 to 600 PPEs a day will be used once we get this COVID referral center fully operational, meaning with full occupancy. So we prepared ourselves for that eventuality.
Right. What about ventilators? Is that a problem at the PGH? Ventilators or even respirators, sir?
It's not a problem now because we have 60 ventilators ready to be given to our patients who are in need. 130 patients will be in our hospital. Roughly about 20 to 30% might need a ventilator. So I think 60 will be enough for now.
Okay. With a 20% percentage ratio you're looking at. Dr. Jonas, it's also a bit of good news seeing some of the pictures we saw on your Facebook page. First is thank you to St. Luke's Medical Center and a shout out to Dr. De La Peña for the donation of beds, infusion pumps. Can you please tell us more about this?
Yes, we have a good relationship with St. Luke's Medical Center. A lot of our consultants are actually also consultants of St. Luke's Medical Center. And just like what was promised by St. Luke's, they said that they will help PGH put up a well-equipped COVID referral center. So just like what we mentioned, they gave us beds, very modern beds that will make the treatment and management of our patients easier, and also it will also be very helpful to our providers. And then we also got infusion pumps, and then also actually 10 million pesos worth of anything that we wanted to buy in terms of equipment and supplies.
Very good news. And I want to add to that, of course, also Angel Locsin and her fiance, Neil Arce, also there donating tents and air conditioning units.
Yes, they did. Marami pong nagmamahal sa PGH. So not only Angel Locsin, we know just like what you, yeah, Angel Locsin donated tents that can be used as part of the sanitation of our workers. They can go through this tent and they can probably be sterilized a little bit. We also got air conditioners. We have a good way of accessing getting donations now through our PGH Medical Foundation, and we put up a Bayanihan na COVID-19 resource center or action center, wherein we centralize a lot of things, which will make sort of like a command center, really.
Yeah. You know, also just wanted to bring this in. There was also a message I saw on Twitter from a doctor, Dr. Noreen Manzano. It's also an appeal from her co-doctors, doctors rather, in PGH, asking for electric fans for the wards, for the nurses. And we actually reached out to Dr. Noreen Manzano, and she said that the support has been overwhelming. There was enough equipment on the first day that this was brought out, and she would just like to thank all those donors as well. So yeah, it looks like there's a lot of donations coming in the PGH. But Doctor, I don't want to end on a sad note, but there is a bit of unfortunate news. I think also one of your doctors did not make it due to pneumonia and COVID-19, sir. This is Dr. Leandro Resurrection III.
That's right. That's right, Pinky. It's really a sad news for the medical community. We lost another doctor, Dr. June Resurrection. We call him June. Is a consultant of many hospitals, including the Philippine General Hospital, Philippine Children's Medical Center, and National Children's Hospital. He is a pediatric surgeon, well-liked by so many.
Our condolences to the family of Dr. June. Dr. Jonas, we'd like to thank you so much for your time. Keep safe, and thank you for the work that you all do there at the Philippine General Hospital. Maraming salamat po.
Maraming salamat, Pinky.
Familiar names, well-known personalities, even those in government are not spared from the coronavirus. COVID-19 affects people on all economic and social levels. Our international colleague CNN's Chris Como announced on Twitter he has coronavirus. Como said he was exposed to people who tested positive, but he assured he's feeling well and will continue to anchor his show from his home, much like we do here on CNN Philippines. Como said his symptoms include on and off fevers, chills, and shortness of breath. He also said he hopes he didn't infect the rest of his family because that would make him feel worse than his illness. Como is based in New York City and is the brother of New York's Governor Andrew Cuomo. New York is now the epicenter of the coronavirus in the United States. Well, 2020 is far from over, but we've been through so much in the first 3 months. What have we learned so far? For this netizen, every moment counts, so we should be grateful for what we have. Another one sees 2020 as a chance to be enlightened and make a wise decision when Filipinos vote in the 2022 polls. And finally, this netizen tweets kindness and the spirit of bayanihan must be present in our daily lives. Share your thoughts with us on social media at CNN Philippines. And thank you for joining us here on The Source. I'm Pinky Webb. Keep it here on CNN Philippines for news you can trust on the COVID-19 pandemic.